So I'll just jump to the next one if that's okay, which is the opposite side, that often the person with the who's had this secret life can get mislabeled as well. And so I would say that number one, both with clinicians and social media, is that the person often gets labeled as a narcissist. And truthfully, it's probably, like you just said, both about that everyone has traits of borderline. Mm-hmm. We all have traits of narcissism too. And so what exactly is a narcissist is, like all things, is a very specific criteria. And so, yes, there's a lot of selfish behaviors that have gone into this person's secret life, but I think actually it's either a misdiagnosis or too easy of a diagnosis just to label someone as a narcissist. And it probably won't get them the treatment that they need. Because outside of this area, often they're very compassionate and caring people. And we know many famous figures, religious, spiritual leaders, who've had secret sexual lives, but yet were not narcissistic in other places of their lives. So to label someone a narcissist is often an easy write-off and not going to actually address the underlying issues. Other ones that I've heard are psychopath, sociopath, monster, from clinicians, not just from, bereaved and betrayed partners, zero empathy, and then observations on their behaviors, which are things like not feeling, shut down, unable to have any empathy whatsoever. And then the other behaviors which show up, which I talked about in one of the videos that we sent out to anyone who registered, which is defensive, argumentative, litigious, and angry. And so those behaviors often get called out in a very different way and sometimes become the focus, and that's not really the issue.